Good afternoon. I'm here to talk today about patient centricity and how we can rebuild trust for a human-centered data economy. I'm Julian Ranger and I'm the president and founder of digi.me. So if we look to the wider world outside of health, but also including health, we understand that we need one thing to make all of our new capabilities work, and that's the availability of rich consumer data. And in this modern world, that has to be with full privacy, security, and with consent. And so therefore, we're seeing worldwide a move to what we can call human or consumer centricity, where the individual owns and controls their data. And we'll see why that is in the next few slides. But this has been legislated for across Europe, across the States, in South America, and in Asia. And here in Australia, as the consumer data right is the beginning of the same thing. And it is a different data model. It's one where the data is effectively democratized, because once you give it to the individual, then the individual can use it for any purpose. And it's not constrained within the data stovepipes it came from. And more importantly, it has privacy, security, and consent at its heart. So if we look today, we have a real problem with sharing data amongst any community, whether that's in fintech, whether it's in consumer personalization or personalized health. But if we look at some insights around the individual is the only one who knows where all their data is, all their data sources. The individual has always had a right for their data. It is now being made more of an electronic right. And the individual has unlimited data usage rights. I can print off my health data if I want to today, put it on the windows of my car and drive around and show everybody, but nobody else can do that. So it's very clear that if you want to bring all the data together about an individual, you can only do that at the individual. And that's when we bring in what is called a data facilitator. And that actually is what digi.me is. We're one of a group of data facilitators. We literally help individuals get their data, decide where to store it for themselves, all fully encrypted. So you can use Google Drive, Dropbox, OneDrive, or several others. And then you, as an individual, can decide to share it with any app or service, simply asking you for the data using the consent stack that digi.me enables. And that is a single API call with a consent certificate token. And if the individual says yes, their digi.me extracts a copy of the data and passes it to that app or service, and allowing that app or service to process the data on the individual's device, or to take it off if that is what the service so requires. But essentially it means that now any app or service can have any data about an individual without problems of data stovepipes, etc., with one proviso, provided there is a value proposition that the individual consents to. Now that value proposition can be a service, a convenience, or a reward. For example, if there's a diabetes app that's going to keep me alive and it wants my wearables and some of my medical data in which to do that, well, I'm probably even going to pay for the app and give it my data. But on consumer personalization, maybe I'll accept using my data to give me a recommendation, but I may want some money off, or any of a large number of value propositions. But human centricity is happening all around the world. When we think about it in the medical sense, it's even more important, I would say. And that's something called patient centricity, putting the patient at the center, which is, after all, what has always been considered to be the right thing for dealing with patients. We need more and better data in healthcare, especially as we move towards personalized medicine and personalized care. We can't have gaps in the data. There are many more data sources now that are outside the classic healthcare setting that we're used to. whether that's wearables, genomics, whether that's private care versus public care, whether that's when I'm traveling, all sorts of different sources. And we must always respect privacy, security, and consent to use that data. And what I hope I'll be able to show you is that patient centricity can meet that challenge by improving the quality and the extent of the data available, and hence the patient outcomes in all situations, wherever you are, whether you're at a medical facility, whether you're at home, whether you're at traveling, or whether you're in a care home. And also how that increases trust, increases the efficiency, is easier to use, and reduces cost and complexity within the healthcare systems. So let's look at patient centricity. The current health IT model is broken. We don't know where our definitive health record is. This is from the UK. The UK does very well. It has a lot of my data at GPs, but it doesn't have all the emergency and acute data. There's consumer health products, there's private health, there's wearables, and there's other information as well. This only works if we bring data together at the only place it can be brought together, the individual. There's been a lot of discourse about this through the world, and you can see some of that discourse at this site here. But essentially, it says we need a new model where the data is at the patient. And just as I showed you earlier, you need a data facilitator. An individual has a tool just like an email program. An email program is my data facilitator for emails. I choose my email channels, I authenticate, and then a miracle happens. All my emails arrive all the time, and I can see, search, and share them. Well, it's the same with other data, whether that is your medical data, or your wearables, your genomics, or it's your finance or social data. A data facilitator such as digi.me enables you to select that channel, to authenticate, and then all of your data comes down directly to you. We don't see, touch, and hold the data. You then have it in your own store, and with a consent stack that is really easy for services to use, a single API call with a single certificate number serving up the data with consent, the data can flow. But it's really important to understand that this is data which the individual holds, and the data facilitator is nothing more than a software program enabling the individual to have their data. But that data is decentralized and fully secure. And in fact, our particular product has been audited for privacy, security, and indeed safety in a health perspective by various nations already. This also works across all data, which means that you're not constrained as we move forwards, whether that's phenotypic data that you want, or wearables, or food, anything is available within the system. So where is this enabled today? Who is doing this? Well, actually, there are quite a few nations that are moving forwards, and moving forwards quite fast. Iceland, we worked with Iceland back in 2016 to create the world's first national citizen-facing API for data. And every Icelandic citizen can get their data and reuse it today. In the US, where there's a multiplicity of data standards, by the way, but that is handled by businesses like us that normalize all the data when it comes in, there is legislation called Meaningful Use 3, which mandates that every patient can have their data back, patient-directed data, back to the individual. In the Netherlands, the same is with their MedMay national framework, which we've also implemented and been qualified for. And they're even giving an incentive. So businesses that enable individuals to retrieve their data are paid €7.50 per patient. And this is a model that is likely to be copied throughout Europe. It is seen as so important that individuals have their data to enable the future of personalized healthcare that it is being incentivized massively. And in England, we've worked with the UK NHS to open up the healthcare records, and that has already covered 90% of the citizens of England, and actually in Wales and in Scotland, but it's slightly different percentages there. Now, does this all work? Does human centricity, consumer centricity, patient centricity, does this process of returning data to the individual work? Is it secure? Is it safe? Does it provide the advantages that I am saying that it does? Well, not looking specifically at health, but looking across the piece. There was a big data mobility infrastructure project last year in the UK with various different participants. It did include health data, but not formally the NHS. And that came out with very straightforward conclusions. Personal data sharing through the individual with a data facilitator can be made safe. That means private, secure, safe, as in the individual can understand, can reasonably consent and deal with their data. That you can have valuable services using that data. It is straightforward. And you need a breadth of data. And that is an important point. This doesn't work brilliantly if it's single sector, so just bank data, for example. It is the breadth of data that allows all of the different aspects to work. And then if as an individual, I have all my data, then now we can enable the wider patient-focused ecosystem. I can have health service apps promoted and prescribed by the health service that can work on my phone. Because I now have my data on my phone, then the apps can access the data directly. We don't have to try and create some pan-national program which all of the apps will come through to with all of my data flowing in places I don't know. I download an app, it asks me for the data. If I am happy with the value exchange, I can say yes. And that can be specific health service apps or consumer apps. Now, wherever I go in the health ecosystem, I have my full data. I can share that with the health ecosystem, especially if I move from one location to another. I can provide the health ecosystem with data it doesn't already have, whether that's genomics, whether that's advanced wearables, whether that is food or social data, which is quite important for mental state. And then the research community can now access that data with my consent. But when they now are looking for participants in trials, they can get rich data. And that enables trials to go so much better, enables futility analysis to be done better, can reduce the costs between 100 and 900 million pounds per drug development. One of the chief medical officers of one of the world's largest pharmas calculated in a study they did with ourselves. It is a fundamental change in the ability to share data, and highly simply, because all anybody needs to do is provide the data back to the individual, a single API, and request the data from the individual. In the UK, there are already patient-centric use cases using NHS data, and more are coming through and being developed. The same is happening in Holland, Iceland, and in the US. So let's bring this to life today. Let's think about, well, early next year. We have got issues with COVID today. Now, really good news in the last few weeks, that worldwide there are a number of vaccinations. But we're going to have to look and understand how those vaccines work within each nation. Are they as effective? Are there groups or others that are not being protected? How does it work in the real world? And that means that a large amount of data needs to be collected, whether that's the vaccination status, current health status of individuals, are they suffering from COVID post-vaccination or not? The medical records, so that we understand why some people might not be being protected and others are. That's a hugely difficult integration task when thinking about where that data is held today, to try and bring that all back, let alone dealing with consent if the individual isn't part of that data journey. But if you've got patient centricity, if I have my record of my vaccination state and my COVID tests, I have my medical records, and I can also be putting in self-assessments as to how I'm feeling, well, then there is only one place to have to go to get the information required. And we know from the millions of people who've shared self-assessments to various parties through COVID that we are willing in this environment to share our data from ourselves. So with patient centricity, understanding how the vaccinations for COVID are working, being on top of that in real time is straightforward. Without patient centricity, I would suggest that that is going to be a very complex activity in each nation around the world. So patient centricity brings new opportunities, richer, wider, longitudinal data, far in excess of what is otherwise available, but more importantly, complete, private, secure, and consented. But let's not forget what's on the right-hand side. It's far simpler integration when you only have to go to the individual for their data. It is far simpler to create an ecosystem of apps and services. It is far simpler to bring the data together about an individual at the individual and ensure there are no gaps which can be critically important for individuals' healthcare. And the data compliance is easier too. If I'm using, for example, a diabetes app, it doesn't need to take all my data to some centralized store where it might get leaked or hacked. It can actually process all the data on my device. So in many, many ways, patient centricity enables enormous benefits across the entire health ecosystem. This was put together several years ago and is still valid today. Across each sector of the medical system, if we give data back to the individual and ask for that data from the individual, we enable a simpler but more comprehensive health ecosystem. And it only requires one thing: empowering the patient with their data. And after all, if the data is about me, then it is of course reasonable that I should see that data, hold that data, control that data, be able to reuse that data. And the fact that it makes everything simpler, eases integration, allows new services is the benefit. And all of this can be done today. It is already being done today in other nations. It is spreading. It is my hope that Australia will be amongst the leaders in this field and adopting and benefiting from patient centricity. Thank you.